Members, the conversations are too loud. If you want to sit down, Jerry. If you want to make a personal statement in the manner that you now digressed to, you seek the chair's approval, and I have no problem with that. You remember I even came to see you in the hospital. So if you want to make a statement about the attack on you, focus on that. But you cannot use your statement on GAF to digress into something very personal. The two are not related. So I disallow you. But if you want to make a statement, we can allow you tomorrow. The Deputy Speaker will be chairing the morning session. She can allow you. You can make a personal statement. And when you make the statement, avoid the temptation to attack people who can't defend themselves in this house. On the matter that you have...
Most obliged.
Okay, thank you, Wakili. On the matter that you have raised, Honorable Member for Kirinyaga, we don't need to set up a committee. Majority Leader, you need to listen to this. I direct that matters relating to NGAAF, NGAF, from now on going forward, this is a social fund. This matter will be handled by the Committee on Social Welfare. And any matters relating to NGAF should be directed to the committee, Departmental Committee on Social Welfare, and that is the committee to which all NGAF matters will be directed to. Social Protection, Committee on Social Protection, any matters relating to NGAF, any questions relating to NGAF, any agitation about NGAF, any complaints about NGAF will go to that committee. So, Majority Leader, communicate with the committee accordingly and inform the 47 beneficiaries of NGAF that from now on, that is their point of call. Thank you. Next. Yeah. Honorable Anthony Olwoj, member for Madare.
Thank you, Honorable Speaker. I rise to raise a request for a statement regarding the projected funding ceilings for the Kenya Rural Roads Authority for the financial year 2024, 2025, and 2025-2026. Honorable Speaker, pursuant to the provisions of Standing Order 44-2C, I wish to request for a statement from the Chairperson, Departmental Committee on Transport and Infrastructure regarding the reduction of the projected funding ceilings for the Kenya Rural Roads Authority for the financial years 2024, 2025, and 2025-2026. Honorable Speaker, in a circular dated 16th of August 2023, the Kenya Rural Roads Authority, KERA, directed all regional directors of the authority to implement a reduction of the constituency roads allocation from 22% to 15%, and the critical roads allocation from 10% to 6.8%. Subsequently, the constituency roads committees, the CRC, were and have been requested to forward revised work plans for the financial years 2024-2025 and 2025-2026 in line with this directive. These reductions will greatly affect the maintenance of works undertaken by or in the constituencies. Honorable Speaker, the Kenya Roads Board Act requires the National Assembly to approve all proposed programs under the Road Maintenance Levy Fund. Notably, the proposed programs did not receive the approval of the National Assembly. It is against this background that I request for a comprehensive report on this matter from the Chairperson of the Departmental Committee of Transport and Infrastructure. Signed, Anthony Tom Olwoj, Member of Parliament, Madare. I thank you, Honorable Speaker.
Thank you, Honorable Olwoj. Honorable GK, you are the chairman of the committee. Are you in a position to say something, or we give
Yes.
you time?
Yes, I am able to say something. Honorable Speaker, thank you, Honorable Oruoch, for raising the matter.
Are you saying something preliminary or something comprehensive?
I want to say preliminary and then I'll say comprehensive later.
Okay.
So the supposed reduction or hypothetical reduction of road maintenance fuel levy fund, Honorable Speaker, is something that was discussed somewhere in Naivasha by the summit of governors. Honorable Speaker, it concerns the financial year 2024-25, not the current financial year. And Honorable Speaker, this morning, my committee met, the Committee on Transport and Infrastructure, and we did a report to require the DG of KRB and the DG of KERA to recall that circular, because only Parliament can amend the Road Act. There is no way KRB or the Governors Summit will be able to amend the act that allocates money to our constituencies. So I want to ask the honorable member, do not be overly concerned the issues that were raised outside Parliament, because we are the only body that is mandated to change the law. Honorable Speaker, I think that settles the matter.
Yes,
but shortly, Honorable Speaker, I will table the report. It's almost ready. I'm waiting for the clerk to bring it over here, and I'll make a comprehensive statement. That will take not more than 15 minutes.
Yes, Junet.
Well done.
Mr. Speaker, I want to congratulate the chairman for trying to answer the question. But Mr. Speaker, he has said here in the House just now that this matter was discussed in Naivasha in a forum called IBEC. And we are not members of IBEC. Parliament is not represented in IBEC. Yes. That is a forum between the executive and the devolved bodies, the executive and the county government, Mr. Speaker. Mr. Speaker, for people to purport to sit in a room in Naivasha to decide on matters touching on constituencies, Mr. Speaker, is an affront to the Constitution of the Republic of Kenya, Mr. Speaker. Mr. Speaker, we want to urge that before the Director General of KRB appears before the committee, he should appear before the committee when that circular has been revoked, Mr. Speaker. Mr. Speaker, this issue of the roads levy fund and the constituency roads fund is not something that started the other day, Mr. Speaker. It is as old as when you were in this parliament, Mr. Speaker, or before, Mr. Speaker. So, Mr. Speaker, the chairman should not take this matter lightly. Otherwise, the consequences will be messy and noisy in this House, Mr. Speaker. Thank you very much. And it will have casualties like the Director General of KERA.
Honorable Junet, you may be required to pay royalties for intellectual property rights. Yes, Ichungwa, Majority Leader.
Thank you, Honorable Speaker. Honorable Speaker, Junet may not be aware, because he was out of the House for some time, that there is somebody in the House who holds the patent for the noisy and messy, and there shall be casualties phrase. Just like the Honorable Junet holds the patent of one to do with something with cows. Na hii imeenda. Hii imeenda, that is Junet. Something to do with cows, that is for Junet. But Honorable Speaker, on the issue of KERA, Honorable Speaker, it's true what the Honorable Junet says, that there is nobody who can amend existing laws other than this House. And even on the statute that established the road maintenance fund that funds the 22 and 10% kitty in KERA, Honorable Speaker, it is only this House And indeed, the communication that I did in a statement that I tabled before the House from the Cabinet Secretary for Transport and Infrastructure, he asserted that fact. Until and unless this House changes the law, then the funds remain as they were. But Honorable Speaker, I would want to beg, since the Honorable GK, the Chair of Transport Committee, had indicated that they have interacted with the agencies and you'll be tabling a report, we allow him to table that report when it is ready, and hopefully maybe we can have time to deliberate on a report that is already tabled once we benefit from what the agencies have indeed said. But just to reemphasize that the status quo remains, and it must be that way until and unless we amend the law. Thank you, Honorable Speaker.
Honorable GK, the chairman, is he here? You may now table your report and give notice of motion simultaneously.
Honorable Speaker, I beg to lay the following paper on the table of the House today, Tuesday, 26th September 2023. Report of the Departmental Committee on Transport and Infrastructure on its consideration of the proposed reduction of projected ceilings for Kenya Rural Roads Authority for the financial year 24-25 and 25-26. Honorable Chair, I also give a notice of motion for the same. Thank you, Honorable Speaker.
Oh, no, and you don't do that. You give notice of motion.
Honorable Speaker, I give notice of motion.
In the manner notices of motion are given.
Okay. Allow me to read, Honorable Speaker. Honorable Speaker, I beg to give the motion on the reduction.
I beg to give notice of the following motion, then you read the motion as drafted.
Honorable Speaker, I beg to give notice of the motion that this House adopts the report of the Departmental Committee on Transport and Infrastructure on its consideration of the proposed reduction of projected ceilings of Kenya Rural Road Authority for financial year 24-25 and 25-26, laid on the table of the House on Tuesday, 26 September 2023. Thank you, Honorable Speaker.
Thank you, Honorable Chairman. We will allocate you time tomorrow, probably in the afternoon, so that that report can be debated for about an hour to put the matter to rest. Next order. Majority Leader.
Thank you, Honorable Speaker. I beg to give notice of the following procedural motion, Honorable Speaker, that pursuant to Standing Order 33A, this House
This is a motion that you can move without notice. So you move the motion.
Okay. Thank you, Honorable Speaker. I beg to move that pursuant to Standing Order 33A, this House orders that should time appointed for adjournment of the House be reached before conclusion of the business under Order Number 12, in today's supplementary order paper, the sitting shall stand extended until conclusion of the said business. Honorable Speaker, members will note that order number 12 is where we stopped in committee of the whole House on the sugar bill, National Assembly Bill number 34 of 2022, sponsored by the Honorable Emmanuel Wangwe. And Honorable Speaker, at the time we adjourned, we had begun amendments to the sugar bill. And Honorable Speaker, you know I happen to be in Kakamega County, in Shinyalu constituency on Sunday for a church service. And it's indeed a great honor that we have representatives of the people from Kakamega County in the Speaker's gallery. And the question of the sugar bill is a matter that was put under a lot of pressure to ensure that we finish with this sugar bill, Honorable Speaker, and considering the huge business, especially government-sponsored business that is lined up in this last session, it is unlikely that if we go beyond today without processing this sugar bill, it may fall off the order paper the way the House Business Committee has prioritized business, and this being a private member's sponsored bill, is only fair that we accord the Honorable Angwe, the committee chair, the Honorable Mutunga, and more so the members from the sugar belt in Western Kenya and parts of the coast time to be able to propose necessary amendments and pass this sugar bill so that it may be assented into law or processed further through Senate. Honorable Speaker, allow me to request the Honorable Junet Mohammed, the Minority Whip, to second that procedural motion.
Mr. Speaker, I stand to second the motion that has been moved by the majority leader. Mr. Speaker, I want to urge our members who are from the sugarcane growing areas to remain in the House today. For the sake of your people, this bill is affecting the lives of the people who are sugarcane growers. So, Mr. Speaker, I want to urge members, especially the sugarcane growers are majorly on this side of the aisle. Please, there are others also there. Even Honorable Kagogo is a sugarcane grower, Mr. Speaker, for the first time. So, Mr. Speaker, I want to urge members, please, for heaven's sake, remain in the House. Last week, before recess, we went on recess. The bill was almost being completed, but it didn't happen because of lack of quorum. Mr. Speaker, I'm saying on the floor of the House that please remain seated until we conclude that business. And before that business, there are also two important bills that we need to take them very serious. The bills on health care, they are coming ahead of the committee of the whole House. Those bills also are very important. They are affecting the lives of the people, and we need to look at them critically so that whether they make sense or not, because Kenyans are known for changing laws but no benefits, but let's scrutinize them as a House and we support if they make sense. Members of sugarcane growers, I'm repeating for the last time, remain in the House. Thank you, Mr. Speaker. I second.
The question, which is that pursuant to Standing Order 33A, this House orders that should the time appointed for adjournment of the House be reached before conclusion of business under Order number 12 in today's supplemental order paper, the sitting shall stand extended until conclusion of the said business. I put the question. Honorable members, I now put the question, which is that pursuant to Standing Order 33A, this House orders that should the time appointed for adjournment of the House be reached before conclusion of business under Order number 12 in today's supplemental order paper, the sitting shall stand extended until conclusion of the said business. As members of that opinion say aye. Aye. Will those of the contrary opinion say nay? The ayes have it.
Order number 8, the Tribunals Bill, National Assembly Bill number 45 of 2023, first reading. A bill for an act of Parliament to give effect to Articles 1(3)(c), 24, 47(3), 159(1), and 169 of the Constitution regarding tribunals, to establish the office of the Registrar of Tribunals, to provide for the functions of Registrar of Tribunals, to rationalize and regulate the administration and functions of tribunals and for connected purposes. Order number 9, the Preservation of Public Security Amendment Bill, National Assembly Bill number 48 of 2023, first reading. A bill for an act of parliament to amend the Preservation of Public Security Act, Cap 57, to abolish the death penalty. Order number 10, the Digital Health Bill, National Assembly Bill number 57 of 2023, second reading.
Majority Leader, before you move the bill, allow me to acknowledge the following schools in both the speakers and public galleries. Kipsingay Secondary School from Sotik constituency, Bomet. Brigan Academy from Mavoko constituency, Machakos. Kenya Kids Learning Center from Starehe constituency, Nairobi City County. Glory Learning Center from Embakasi East constituency, Nairobi City. Kiio Secondary School from Mwingi East constituency, Kitui County. On behalf of the House and myself, I welcome the institutions, the students and their teachers to the House of Parliament. Thank you. Yes, Nguna, what is it? Give him the mic. Because Mwingi was mentioned?
It's point of correction.
Yes, give him the mic.
Yes, Mr. Speaker.
Yes.
I just rise to raise this question. Not question, I mean to correct you. There is no constituency called Mwingi West. Mwingi East is Mwingi West,
Mwingi
where
West.
I come from. And I take this opportunity to welcome everybody in this house, Mr. Speaker, sir. Thank you.
Thank you, thank you. I think the mistake was made by my team here. It's so corrected, and the Hansard will reflect as Mwingi West. Majority Leader, you may now move the bill.
Thank you, Honorable Speaker. Honorable Speaker, before I move, let me also take this opportunity to welcome all those students who have come to join us, including those from Embakasi East. I noticed their Member of Parliament, the Honorable Babu Owino, was banging the table instead of foot thumping, and I just pointed it out to him that he should foot thump, not bang tables. Honorable Speaker, now beg to move that the Digital Health Bill, National Assembly Bill number 57 of 2023, be now read for the second time. Honorable Speaker, allow me to begin by thanking the Departmental Committee on Health for tabling the very comprehensive report that they have done in a timely manner, having undertaken thorough public participation during the recess. And let me particularly thank them because they did this work at a time when the House was on a working recess and many other members were back in their constituencies, but they sacrificed time to be able to engage with members of the public and all Kenyans, including institutions that are in the health space, to be able to listen to their views and adopt those views in the compilation of their report. And under the able leadership of the Chair, Honorable Pukose, we thank you on behalf of the House. Honorable Speaker, our nation has made significant strides towards digital transformation in various sectors, leveraging on technology to enhance the implementation and delivery of services and products within the digital space, Honorable Speaker. Key among these innovations and transformation, Honorable Speaker, in the digital space, in the financial sector, Honorable Speaker, the most recent, besides M-Pesa, has been the Hustler Fund, where people now are able to access money by simply dialing on their phones without having to fill up papers, without having to know anybody. And Honorable Speaker, the health sector has not been left behind and indeed has made very steady progress in digital technology, transformation through implementation of digital solutions, to manage, share, and use health data. Honorable Speaker, members will appreciate products like MTBA. I have seen a number of pharmacies around the country that are using solutions, digital solutions, to be able to provide and deliver pharmaceutical products to their clients, both consumers or patients and hospitals, and also other dispensers of pharmaceutical products. However, Honorable Speaker, the adoption of technology has been very uncoordinated, characterized by a fragmented implementation with health sector actors not adhering to basic digital health standards, guidelines, recommendations, and digital development principles, Honorable Speaker. These technologies have affected how health data is therefore managed, resulting in multiple disparate systems that have limited ability to exchange data. And the primary object of this bill, Honorable Speaker, or rather this bill seeks to now provide a framework for the provision of digital health services, to establish a digital health agency, to establish a comprehensive integrated digital health information system, and also to provide for data governance and protection of personal health information in the service delivery through digital health interventions, on e-waste disposal, and also on health tourism. And Honorable Speaker, members, you'll see from clause 5 all the way, part 2 actually, almost the entire of part 2 of the bill speaks to the establishment of this health agency, which, Honorable Speaker, from clause 6, members, will see the agency will be established as a body corporate and will develop and operationalize and maintain the comprehensive integrated health information system to manage the core digital systems and the infrastructure required for its seamless health information exchange. It will also develop and implement the infrastructure for health data exchange of health information in a secured manner. It will undertake resource mobilization for implementation of health digitization in the country. This agency, Honorable Speaker, will also certify digital health solutions based on best practices and standards to ensure that all the solutions, digital solutions that are being used in the country, Honorable Speaker, are indeed solutions that are certified. It also, Honorable Speaker, amongst other objectives and functions that are stipulated in the entire of that clause, advise the Cabinet Secretary on matters related to digital health. Honorable Speaker, the bill further sets the minimum standards applicable for the establishment and maintenance of digital health information systems. It provides for the mechanism for interconnectivity between each county information system and the national system. Because, Honorable Speaker, under this comprehensive integrated digital health information system, all our health facilities, right from the primary healthcare facilities at level dispensaries, those at level 3, level 4, level 5, level 6, to the national referral hospitals like Kenyatta, MTRH, KURTH in Kiambu County, Honorable Speaker, will be integrated in one seamless system, and exchange of medical information will become easy. And therefore, Honorable Speaker, if you have a CT scan done on you in Kisumu, at the Kisumu Referral Hospital, a doctor in Kenyatta National Hospital or in Nairobi Hospital can be able to access that scan and be able to advise the person treating you down at the Kisumu Referral Hospital, or indeed a level 3 hospital in Marsabit County, Honorable Speaker. You will not necessarily require to have all manner of consultants scattered around the country, and therefore health personnel will be able to benefit from more experienced personnel at the national level or in our national referral hospitals through exchange of such data, Honorable Speaker, in a system that is seamless and that is secure, and where patient's data, Honorable Speaker, is safeguarded, and you are certain that your data as a patient is not subject to abuse or to be misused by characters out there. Honorable Speaker, this bill also seeks to facilitate the realization of the right to protection of personal information as guaranteed under Article 31 of the Constitution of Kenya 2010 and under the Data Protection Act number 24, 2019. Honorable Speaker, members are aware that the enactment of the Data Protection Act of 2019 presented very new challenges for the health sector in Kenya, as the sector handles very sensitive patient data whose protection requires more safeguards. And therefore, this bill fills that gap to ensure that patient data is indeed safeguarded. Because, Honorable Speaker and members of Parliament, Honorable Speaker, in the past have been victims where their patient data has been leaked to people who should not be holding private or otherwise very confidential patient data. Therefore, with this new bill, Honorable Speaker, nobody, be you a member of Parliament or any Kenyan who is attended at a health sector facility anywhere within the country, should be apprehensive or afraid that their patient data will be accessed by people who have no right to access that data. Honorable Speaker, the bill also enhances the health data governance framework in the country by requiring all healthcare providers and health facilities to adopt mechanisms to ensure the safety and security of patient information, Honorable Speaker, as I have articulated before, that Kenyans now will have the ability to have more control over their personal data, particularly in health facilities, because they will now be required to give consent before the collection, processing, and sharing of their personal health-related information. Therefore, Honorable Speaker, with the adoption of this bill, Honorable Speaker, nobody has to fear that any data that is collected from you will be shared without your consent. You must give consent for your data to be collected, for that data to be shared with anybody, even if it is another referral hospital or another health professional. It must be shared with your consent. And I must thank the committee, because they are indeed very emphatic, and I have seen from the report as they engage with stakeholders to ensure that data protection for patients is very well safeguarded. And therefore, this bill, Honorable Speaker, besides what is provided for in the Data Commissioner's Data Protection Act, Honorable Speaker, this bill provides further safeguards on more railguards to ring-fence data that is coming from the health sector. Honorable Speaker, the bill further regulates the processing of health data, and in particular the health data that contains sensitive personal data through technological mediums such as telemedicine. In this regard, Honorable Speaker, the bill requires healthcare providers and technology platforms that offer telemedicine to put in place several safeguards, including anonymization and de-identification of sensitive personal data. Honorable Speaker, what this de-anonymization and de-identification means is that you'll be able to transfer data or share data in an anonymous manner or without clearly identifying whose data is. Therefore, Honorable Junaid, because I see him holding his chin, must not worry that anybody will share his health information in the hospital, although I know he likes traveling to London, Honorable Speaker. But I was saying he is one Junaid Mohammed or one Kimani Ichung'wah being treated in Olusegun Sub-County Hospital in Kikuyu, in Nachu Ward. Honorable Speaker, and operationalize and maintain this comprehensive integrated management information system that is established under part 4. Part 4 of the bill, Honorable Speaker. And this integrated management information system will ensure that we have a means services, government services online, your digital system. Your health consultant or your health personnel at the local level can share that with experienced health personnel in referral hospitals. Junet was alluding to when he seconded me on the procedural motion, that these health bills are indeed critical for our nation and for our people. It is up to us, functional healthcare system that we can now fix, and we have that golden opportunity, Honorable Speaker, as I move and request the Chair of the Health Committee, the one and only Dr. Pokose, to second.
Dr. Bukose.
Honorable Speaker, I beg to second. Honorable Speaker, allow me to thank your office and the office of the clerk for the manning at times into very late hours in scrutinizing this bill before this committee came before our committee. Honorable Speaker, I also am lending a team led by Dr. Mwai in making immense contributions to this bill. Honorable Speaker, the Kenya of His Excellency President Ruto has to the care they need, regardless of their location or financial situation. Honorable Speaker, this bill establishes the Digital Health Agency, which establishes a comprehensive, integrated digital health information system in fulfillment of Section 105 of the Health Act, number 21 of 2017, which obligates the Cabinet Secretary to establish an integrated, comprehensive health information system relating to the national government health functions and to every county in respect of their county functions. This agency will be domiciled within the Ministry of Health. The bill therefore seeks to consolidate and harmonize information obtained from both levels of government. It also provides for intergovernment, that is from county to county, integrated system where they are able to communicate and be able to link up in matters health. The bill further sets the minimum standards applicable for the establishment and maintenance of digital health information systems. It further provides the mechanism for interconnectivity between each county and the information system and the national system. This will assist both levels of government in coming up with the consumer-focused and prevention-oriented care at all levels of healthcare services, which will ultimately reduce the disease burden within the country. Honorable Speaker, we had immense contributions from the Council of Governors in this bill, and therefore the county was ably represented. The bill facilitates the realization of the right to protection of personal information as guaranteed under Article 31 of the Constitution of Kenya 2010 and under the Data Protection Act number 24 of 2019. The enactment of the Data Protection Act number 24 of 2019 presented the new challenges for the health sector in Kenya as the sector handles sensitive patient data whose protection requires more safeguards. The bill therefore fills this gap, which is crucial in light of the fact that privacy concerns and data breaches are now more prevalent. Honorable Speaker, this bill enhances the health data governance framework in the country by requiring healthcare providers and health facilities to adopt mechanisms to ensure the safety and security of patient information. It also gives Kenyans the ability to have more control over their personal data, particularly in health facilities, as they must provide consent before the collection, processing, and sharing of their personal health-related information. Honorable Speaker, this bill further regulates the processing of health data, in particular health data that contains sensitive personal data, through the technological mediums such as the telemedicine. In this regard, the bill requires healthcare providers and technology platforms that offer telemedicine to put in place several safeguards, including anonymization and de-identification of sensitive personal data. In this way, the bill regulates the largely unregulated telemedicine and e-health platforms, among others, which will guarantee the safety of Kenyans using such platforms. Honorable Speaker, yesterday the President launched distribution of community health promoters kits. And in those kits, they have gadgets that they are able to collect sensitive information. This sensitive information will be sent to the Digital Health Agency. And within the Digital Health Agency, any information pertaining the disease burden within various areas can be able to be interpreted and be able to be stored to access in healthcare delivery within our country. We can also be able to monitor who is working and who is not working. We'll have close to 100,000 healthcare providers within our country, in all corners of this country. And in every constituency, they'll be represented. Each healthcare provider will be in charge of 100 households. Within those 100 households, they'll be able to take information pertaining what diseases people have, what can be referred, what can be advised in terms of management, what other preventive measures that can be put in place. All this information, Honorable Speaker, will be captured within that gadget, which is the M-Mobile, the M-Health, that is mobile health. And this can be sent to the Digital Health Agency. And within the Digital Health Agency, that information can be stored. Honorable Speaker, we also have the e-waste in terms of how do we dispose of that information and at what time we'll be able to dispose of that. So tomorrow, once the House Business Committee puts the bill for the Committee of the Whole House, then we'll be able to discuss further and be able to look at what amendments the committee has made, what amendments we've gotten from the public participation, what amendments members can be able to propose to enhance and make this bill a better document. With those few remarks, Honorable Speaker, I want to second. Thank you.
Thank you. Order, Honorable Njeri. Take your seat. Honorable Njeri, take your seat. Honorable members, I now propose the question, which is that the Digital Health Bill, National Assembly Bill number 57 of 2023, be now read a second time. Julius Olesunguli. The problem of keying in and leaving the chamber. Victor Koech, I hope you have Sungul is here. I'll give him the opportunity to contribute. He was the first on the list. Sungul, you can be given the mic anywhere, but go to where you are most comfortable with. Give all. Julius, before you take the floor, allow me to acknowledge in the speakers and public galleries, Greenview Secondary School, Mwanza Constituency, United Republic of Tanzania. Ole Sangale Junior Secondary School, Narok North Constituency, Narok. Kwa niaba yenu na kwa niaba yangu tunawakaribisha wanafunzi wale kutoka Tanzania na Narok kwa jumba hili la bunge na tunawatakia makazi mema. Sunguli.
Out. Sorry, I think the mic is. I wish also, before I make my remarks, to say karibu to the students whom you have just acknowledged, especially from the great county of Narok, particularly one of the oldest schools in Narok, Ole Sankale. I want them to feel quite welcome in Parliament. Mr. Speaker, this bill, the Digital Health Bill, is one of the two bills that we are going to be discussing, which have been thoroughly deliberated on by the Committee of Health. And I want to really thank my colleagues in the Committee of Health, because the Committee of Health has very prominent members of Parliament from particularly the medical profession, led by our chairman, Dr. Robert Pokose, and ably supported by other doctors, not to mention all, but in particular Dr. Nyikal and our friend Professor Jaldesa. So this committee is very well populated by the medical personnel who actually are the experts in this field. And I have been privileged as a lawyer to have to midwife these particular bills, the ones that we are going to be discussing today. Now, this particular bill, Mr. Speaker, acknowledges the fact that we have all moved, and that now we need to acknowledge that digitization is here with us. I particularly want to single out one element of digitization that is going to be very helpful to the people of Kenya, and this is telemedicine. It is now possible that there is a doctor, say at Aga Khan, who will look at and review a patient in Kilgoris and prescribe treatment for that patient. Or a patient in Washington, D.C., sorry, a doctor in Washington, D.C., looking at a patient, say, in Nairobi. But this also poses the challenge of what happens to the information that the doctor or the medics come in possession of. And this bill regulates this area, because this area has been highly unregulated in the past. This bill, Mr. Speaker, has been well thought out, and we are confident that upon passing this bill, the medical profession will be well guided on what to do with people's information. Mr. Speaker, one of the important things in the medical profession is privacy of information. And the bill has a number of ways of dealing with the privacy of information. One of the ways is to make sure that the names of the patient are not revealed to anybody, especially the person requiring that type of information. And that is what we call anonymization. There are many ways that we have devised in this bill that will make sure that the information that is gathered and that is stored in a manner that is quite secure. Mr. Speaker, we commend this bill to our members, to our fellow members in this House. It's a good bill. We have also, indeed, we will propose a number of amendments to it that they are not going to be that substantial. As it is, it's a good bill, and I do support.
Thank you, Sunguli. Victor Koech, member for Chepalungu.
Thank you. Thank you so much, Mr. Speaker. While I rise, I want to appreciate the Departmental Committee on Health, led by Dr. Pukose, for a well thought about this particular bill that will go eventually to solve the issues that our patients have been facing. Having a particular case whereby our patients travel for long distances, and now upon passing of this particular bill, our patients are able to be reviewed by doctors staying in Nairobi. Mr. Speaker, while we support this bill, it is also a common known fact that our local hospitals have inadequate equipment. although this bill is going to offer solutions in equal measure, we would like to make recommendations that the local hospitals like Sigor Hospital, a sub-county hospital that is in Chepalungu, have to have the requisite equipment so that when patients can travel for less distance, a review of their health can be done in Nairobi efficiently. Mr. Speaker, I want to support this particular bill. Thank you.
Nelson Wamboka. He's not here. Ken Chonga. Have you keyed in for this bill? Those who do not wish to speak to this bill, you can, because the screen is full. Ken Chonga, are you for this bill?
No, I'm not for this bill, Mr. Speaker.
Okay. Yield the floor to Mother Wangari.
Thank you, Mr. Speaker. Now to join in congratulating the Health Committee for this bill, which will go a long way in terms of getting efficiency in how we handle our health records. And Mr. Speaker, the one issue that I've liked that this bill has addressed is, of course, the management system and also the cooperation, as has been stipulated in the Constitution in Article 187, 189, of the cooperation between the two levels of government. Because I think what has been ailing the health sector, Mr. Speaker, is that there is a disconnect between the two levels, and I hope that what we saw yesterday with the President launching these kits together with the county governments, there will be smoother operations even in the counties, Mr. Speaker. Mr. Speaker, the other issue I would speak to is the issue of the interlinkage with other institutions and officers. This, Mr. Speaker, I have in mind the issue of the government chemist. Mr. Speaker, a week ago, in my constituency, in a village called Kasambara, one young girl, 12 years old, Jasmine Joki, was waylaid from school, raped, and killed. And Mr. Speaker, the DNA samples that have been collected by the government and by the security officers has to be taken to Kisumu to assess whether the suspect is actually culpable, Mr. Speaker. So I would hope that this bill will be able to actually address the release of issues of DNA in terms of sexual offenses, and I hope that this can be done especially under Article 36 in terms of disclosure of data. It provides on the areas where this data should be provided, and they have said legal requirement, Mr. Speaker, but I wish that it can be more expressed, specifically on issues that touch on defilement and rape, that this data, the DNA and the DNA samples and information, Mr. Speaker, can be easily shared even to the enforcers of the law, even to the court system, so that we can get pedophiles jailed, we can get the criminals jailed, and this information, Mr. Speaker, should not be able to take such a long time. It should be more efficient. You don't have to travel to a different city, you don't have to travel to a different town to be able to get this information. It can be easily be transmitted, Mr. Speaker. The other issue, Mr. Speaker, that is very important is, of course, the issue of privacy, because matters, medical records are very sensitive, including not only us, every member, Mr. Speaker. That is why you visit the doctor alone. And this bill has tried to address that and has looped in the issue and the Office of the Data Commissioner, so that we have credibility that the confidentiality, the privacy and security of any data that any person or any person shares with a medical practitioner, it's protected, Mr. Speaker. And you know, Mr. Speaker, we are just coming from a time when we were dealing with the WorldCoin that was recently a major issue in this country, Mr. Speaker, and the safety has not been guaranteed as we await the report of this special committee that was formed, Mr. Speaker. I hope this confidentiality will be guaranteed, the data commissioner to be on top of it, Mr. Speaker. That way we'll be able to protect the information that is shared in any form or any manner in any of the institutions of our country, Mr. Speaker. But I think it is a good bill. We would be proposing some amendments at the committee stage, but I think at this point it is very important, even in terms of e-waste materials, and the important fact that they have looped in the county governments, because the practitioners are not just in Nairobi, are not just in the referral hospitals, they are not just in the national institutions, Mr. Speaker. The practitioners are in the counties, Mr. Speaker. But with those few remarks, I beg to support. Thank you, Mr. Speaker.
James Nyikal.
Thank you, Mr. Speaker, for giving me this opportunity. Mr. Speaker, this is an extremely important bill for the health services in this country. Mr. Speaker, in health there is massive information. If you start at the individual level when a patient is being looked after, you see those huge files. It is full of information on the individual. That information has to be handled. Mr. Speaker, we even use this information to manage people, and now with e-health, we can actually manage people at long distances, and we need that information. That information must be transmitted from one place to another, not only within the country, but must also be transmitted internationally, because people do move across the world seeking health care. So, Mr. Speaker, even actual management of patients, treating patients, with telemedicine, it is digital now possible to actually manage some cases, even cases of surgery. A lot of information is therefore flowing through the system. And this information is personal information, and it is used for managing patients, and it's used for managing hospitals. Mr. Speaker, beyond that, if you look at health systems, the health systems has massive information, the data that we have concerning the equipment, concerning drugs that you have, concerning supplies. So, Mr. Speaker, this is massive information, and this is what we use to actually monitor how the system is being managed, how our health system is working. Mr. Speaker, if you look at the link between the ministry and the information that comes there in national management, in managing national affairs, in planning, if you look at the health indices that are important, infant mortality, maternal mortality, the under 5 mortality, the access to immunization, access to drugs, these are things that are extremely important in planning. The levels of malnutrition, this is massive information that actually has to be linked to our national data, the Bureau of Statistics, and the Ministry of Planning. So, Mr. Speaker, this is a lot of information that we have. And right now, most of this information is either being managed manually, or if it's being managed digitally, we have little information, little systems all over the place that actually do not talk to each other, and therefore cannot give the information we require. With devolution, Mr. Speaker, this is even worse, because we actually have a huge health information system that now has to talk at national level and also at county level. Now we are doing it manually, and as I said, if we are doing it digitally, the systems we have are actually not coordinated, not integrated. And therefore, it is important, Mr. Speaker, that now we move and digitize all this. And if this is done, obviously it will improve efficiency. But it also introduces a huge risk, Mr. Speaker. The risk that this information that is flowing digitally can be easily accessed. The issue of hacking this information. So there is not only the danger of hacking individual information, hospital information, national information, county information. You can hack every information when you go digitally. Therefore, it is time that actually we look at that, and that is exactly what this bill is doing, Mr. Speaker. So it's therefore creating an integrated health information system, integrated comprehensive health information system, a system that can actually talk to all institutions across the country, at county level, at national level, at hospital level. So that is actually created in this information. Once you have that information, Mr. Speaker, you need to manage data. If data is managed, it's not managed, particularly at national level, Mr. Speaker, it is a danger, it is a risk. It's actually a security risk. And therefore, this bill, creates a system of this data management. Using it, if we have it, that is actually created here. But Mr. Speaker, as I said earlier, if you do not think about it, then what about particularly at personal level, what about the security of the data? What about individual information that people do not want to actually be everywhere? So this bill actually looks like that, where we have said that information can be treated in such a way that you cannot identify the individuals that the information, the data is relating to. So that actually is in the bill. The confidentiality is assured and the security is assured, and people, we have created systems that can employ people who are well versed with management of data and data security. Mr. Speaker, I'll actually compare health data nationally to even actually military security. Because even the military, what is it used, Mr. Speaker? To protect us. Protect what? Our lives. So the information about our lives is equally important. And actually, it can be a security problem. So we support this, I support this bill because it actually gives, creates systems that will deal with that. Mr. Speaker, now, if you imagine all the computers, all the equipment in x-rays, all the equipment in labs, if they are digital, when they are not in use, many of them still have the information inside. As Mr. Speaker, I know, you will know, we had a great American called Edgar Hoover who used to go behind offices and take what was in the dustbins and get information with that. What is our dustbins now is the place we put equipment, digital equipment that actually has been used. So that e-waste, we must find a way of managing it because it will give away the information we have. Mr. Speaker, I had earlier said our people move from this country to other countries. How do we transfer the information? How do we make sure it is safe? How do we ensure confidentiality? Mr. Speaker, this bill provides for that. So, Mr. Speaker, I support this bill. We need it. Whatever health system we'll use, we need it. Even how we use our finances in the health sector is part of the information we have here. So I support, Mr. Speaker.
John Mutunga.
Thank you, Honourable Speaker, for the opportunity to contribute to this bill. Honourable Speaker, I have looked through the bill, and I would like to highlight a few issues, Honourable Speaker, as per my findings. Honourable Speaker, the first thing I noticed is that the bill uses the word retrieval and archival, and these two terms are not defined. I would like to cite clause 21, subclause 3, which specifically mentions those two particular ones, and therefore they need to be defined in this particular bill. Honourable Speaker, when you look at the bill itself, the need for research is not amplified in the bill. The bill talks about governance of the data, it talks about the health, data security, it talks about the e-service, the e-health service delivery, the e-waste management, the health tourism, even tourism, but does not recognize the need for research. This is data we are collecting across the country. This data can be used through data mining. We can know what is happening in the country. And I want to give several examples, Honourable Speaker. The first thing we can do, Honourable Speaker, is to identify epidemics. Using the occurrences or the outbreaks of diseases across the country, we can know at what point in time can we declare an epidemic. We do not have to take health personnel there. Based on the data that we are getting, we can declare epidemic and we can also declare a pandemic. Honourable Speaker, the health facilities across the country will be captured in this data. And the status of these health facilities will also be captured. So it is my belief that through implementation of this bill, we can review these reports frequently and take appropriate actions. Instead of having no medicine in certain parts of the country, we can redistribute medicine across the country based on the information that we are getting from these reports. Honorable Speaker, a capture of this data and appropriate interpretation will help us to guide the forward planning. Honorable Speaker, my understanding of this particular bill is that it's going to bring in integration of information. And integration, I understand that it is possible for somebody to visit a clinic and then diagnosis is done. Or let's say you take up an X-ray, or let's say you take up something like MRI. After this diagnosis is done, or after this report is taken, it is possible for this report to be relayed through electronic system to an interpretation center or another center where it can be interpreted. It is also possible for the administration of the drugs to be given at another point. Then it is possible for somebody to get the drugs without necessarily having to travel to Nairobi or without necessarily having to travel to referral hospitals. In that case, Honorable Speaker, that possibility is created by this bill. And if that possibility is really a reality, then some issues come in which you have to deal with. And I believe the committee needs to look at some of these issues. One of them is the ethical issues. When somebody believes that he was not given the correct medicine because he was not there during the diagnosis. When somebody believes that the cure is not occurring in record time because this diagnosis was done offsite or away, or when somebody, for instance, gets complications, and therefore there is the issue of attribution. The fact that this diagnosis was done far away, those are some of the issues that this bill needs to cure. Honorable Speaker, in view of integration, there is also perceived the ease of identification and capture of the spread of illnesses. Honorable Speaker, it is also possible for us to determine early, to detect early, based on what has been reported in different parts of the country. That ease of identification will help us to move on in a better way than we are right now. Honorable Speaker, I looked at the board. The members of the board, I thank the members of the committee because they have restricted themselves to 6, yet this particular bill is fairly open. But Honorable Speaker, I want to point at one particular member of the board. I'm looking at clause 8, subclause 1, paragraph G. If you look at that particular provision, one person representing the private sector appointed by the cabinet secretary. And then I wonder, who is this person? Which private sector? Anybody from out there, then you appoint and put them in the board? We need to describe who is this particular private sector. And probably we can narrow this one down to either health, private sector health, or private sector ICT. If it is private sector health, will private sector ICT feel denied? We need to look at that very carefully so that we can be sure probably we may need to expand or substitute some of the board members so that we are able to represent the private sector appropriately. Honorable Speaker, if you look at the other issues that are in this bill, and I want to mention one specific one again, clause 15, subclause 1, and paragraph D. In terms of the resources or funds for this particular agency, it is identifying any other funds designated for or accruing to the agency by virtue of the operations of law. And I find this quite open. Honorable Speaker, I think we need some form of censorship of the money that comes into this particular agency. We need to have an authority censoring this particular, or some provision censoring this money. And I have a proposal that probably we can say the CSL, as approved by the CSL. Without that particular censorship, then we have a problem. Honorable Speaker, save for the few issues that I've mentioned, I support. Thank you very much.
Kai Bissau.
Thank you, Mr. Speaker, sir. Digital management of our health system is very important. Improved customer service, because of the quick retrieval of data, is very crucial. It also helps the doctor to attend even to more patients in a very short span of time. And at the same time also, there is the visibility of complete customer history. Secondly, Mr. Speaker, this also helps to remove the physical storage. Space becomes a problem. Space continues to reduce. So by going digitally, it also helps to sort of address those physical storage of this data. And again, Mr. Speaker, this particular bill also addresses the issue of the environment. Looking backward and going forward, there's a lot of paper which comes from trees that has to sort of take care of these physical files. So to me, this bill is also very important addressing that. And at the same time, when it comes to research, despite the fact that team members might be in different places, example, doctors when they are researching, but because of that digital accessibility, they are able, despite their different geographical locations, to be able to do research, of course, in a cost and efficient manner. And also most important, even as I support this bill, Mr. Speaker, I will expect that the issue of data security is addressed, data protection is also addressed, because in a single storage facility, you will have data that covers, the entire country. But it's a very good bill, and I would really like to support it. Thank you.
Thank you. Wanjiku Muhia. Wanjiku Muhia, are you keyed in for this? No. Joseph McClap is not there. Mboko Milemba.
Thank you, Honorable Speaker, for this chance to speak on this bill, which basically brings together and tries to create a database for the health sector. I think we also have this in education, because with NEMI system working, we are able to know the information every student and even movement of a student from one school to another is carried with information about it. And I think the world getting digital, we are taking this to the health sector. So this is a very important bill. And I see it going to bring out a number of things which are good for the society. Number one, it will bring to fore affordability in the health sector, so that there is the bit of sharing of information from one hospital to another, from one doctor to another. And above all, in this level of affordability, Honorable Speaker, to remove the double, triple, multiple tests that are being done on the patients from one hospital to another. A patient attending a hospital in a lower level will undergo the same test in the next level and will go continuously on the same test even at a higher level. And still at every level they pay. So this I see as a big advantage with this bill, because now a test at a particular level can be shared throughout the entire system of health. And then there's an advantage of a test at a higher level being shared across down to the CHV or the CHPs, the health promoters, so that even though they are working at the lowest level, at the ground level handling the 100 people, we were told, they are able to enjoy the tests that otherwise were proven by the health practitioner at the highest level. And I find this very, very important, also given that the sharing of this information can be done across the counties and to the national level, and this will actually basically reduce the cost of health, which is a real burden. In the rural areas where we live, there's something, Honorable Speaker, called CT scan, which is now not only required, but is also proving to be a health menace, that every patient will be asked to go through a CT scan. And this CT scanning is done at every level. So for every CT scan, the patient pays about 7,000 to 10,000. And they are paid all through the way. I think this bill is trying to address that. Honorable Speaker, the sharing of high-level technical medical machines is also achieved. So we realize economies of scale in terms of the medical equipment that we have. That once we have a techno equipment at the Kenyatta Hospital, it can also serve people who are at different levels in different counties, and therefore the cost is actually shared. I also see further advantage being brought by this bill, that how often do we dream that we should get to the high-end hospitals like the Nairobi Hospital, get to Kenyatta Hospital and other hospitals that are at the high end. But with this shared information, it means that we can even share the doctors and their advice and their consultants from the very high end to the lower end level, to the ground level, and this will actually improve and actually bring down the cost of health in this country. However, Honorable Speaker, as we do all this in this bill, we must make sure that the health centers and health places, the hospitals are equipped. Yesterday, I was proud when I saw the CHPs, whom soon I would want them to be called health workers, because they are going to be a crucial part, integral part of the health system in this country. But that's a matter for another day. We need to uphold them to a working level and not just volunteers or promoters. And they got several equipments which will keep data, including the e-waste, the M-Health, and the M-Mobile. But you may realize, Honorable Speaker, that these same gadgets are not in the hospitals and the health facilities that we have around the country. So this must go concurrently with improving not only the medical equipment in our hospitals, but also the human resource in our hospitals, so that the hospitals can become the centers where these ground-level health workers, called health promoters, will actually operate from and become their center of operation. Honorable Speaker, data protection has been spoken about as an important thing for this particular bill in order to protect the data protection of the people who will have gone through the system, and how to dispose of the wastes in terms of data that will have gone into the system. But I also see further an advantage, and somebody spoke on this, I think it must have been one of the honorable members, that the research component that is being brought to bear by this particular bill is very good, because information will be there. And therefore, we are able to discern the most prevalent diseases in this country, and also discern new diseases that are entering into the system and in the country or in the health sector, and take interventions which will actually handle them. And this is very good. So it will actually promote research. And when we shall be doing the third reading, the Honorable Chair, Bokose, who's just up here with me, we will need to actually see how we can also use this data so collected in order to give projections and also enhance research on the most prevalent diseases in this country and undertake the mitigations that are required to deal with them moving forward, Honorable Speaker. So prevalently and largely, this is a good bill that takes our health sector to another level. It is actually a blockbuster in terms of demystifying the health issues and creating space within the hospitals where we have so many files which are keeping equipment. We had this in several sectors, and now it's being removed so that we don't have many files. How many times are people in the villages told, go and buy a book? And I know most of you come from those areas where before you even start being treated, you are being asked to buy a book, and each time you approach a hospital, again you must buy books, simply because we are not digitized. So this is a blockbuster in terms of making this sector more efficient in order to assist the Kenyans. Honorable Speaker, I think with those very few remarks, I want to support the bill. Thank you.
Thank you, Mr. Speaker. Mr. Speaker, Article 43 of our Constitution defines access to universal healthcare services as the right to the highest attainable standards of health. Mr. Speaker, the World Health Organization also defines universal health coverage as access to promotive, preventive, curative, rehabilitative, and palliative health services, Mr. Speaker. But, Mr. Speaker, there are certain things that in this bill, first of all, we used to have NHIF as a department of Ministry of Health. That gave birth to the NHIF Act. The NHIF Act, because of the changing realities, Mr. Speaker, has had certain lacunas. It is these lacunas that this bill attempts to address, Mr. Speaker, through digitization of the health records, Mr. Speaker, through promotion of health tourism, Mr. Speaker, through provision for telemedicine, Mr. Speaker, through provision of health information system, and Mr. Speaker, more importantly, like where I come from, we come from very remote villages, Mr. Speaker. The issue of remote patients monitoring, Mr. Speaker, is something that is critical, because I remember now the constituency that I represent, and this is the second constituency, Mr. Speaker, that I'm representing. We got our first medical doctors, Mr. Speaker, 3 years ago, 4 years ago. You can imagine the challenges those people have been going through. But Mr. Speaker, with this bill, some of these things can be reduced. Mr. Speaker, this will also reduce the issue of administrative costs. The issue of data protection and privacy, Mr. Speaker, will also be very important. The issue of interoperability, Mr. Speaker, you can have one hospital, Mr. Speaker, in the farthest part of the world, having an exchange program with another hospital, Mr. Speaker. Mr. Speaker, the issue of health innovation is also critical. Mr. Speaker, there are certain things that we need to look at. There are countries that have succeeded in the provision of their social health care mechanism, countries like Germany, UK. In Africa, our neighbor Rwanda here, Mr. Speaker, a small country, has had a very successful social health care, Mr. Speaker, mechanism. Countries like India, Indonesia, Ghana in West Africa, Mr. Speaker. Mr. Speaker, these things are critical. But there are certain things that we must also sound that are alarming. Mr. Speaker, the issue of the definition of household. Where I come from, or near you come from, our household means completely different from a household in Europe. And therefore, we'll be amending to provide for a household as an African household, not a Western household, Mr. Speaker. Like if you talk of Aden Kenyan's household, I can assure you, you'll be talking about tens of people. A household in Western Europe means a man, wife, and a kid. If you divide the household of the Honorable Dr. Moses Wetangula, you can imagine, it's a chain. I think these are things that we'll be looking at. We will bring an amendment actually to bring this into life. Mr. Speaker, equally, we're also doing an over legislation. There are certain things that require the fact that we want to modernize and inject a bit of modernism, efficiency, Mr. Speaker, in our healthcare system doesn't mean that we over legislate everything that even requires just some administrative pronouncement. Mr. Speaker, I've looked at this. We want to cure everything. We are defining qualification for the chair. We are defining qualification for the person who is going to be the top quality assurance officer, Mr. Speaker. These things require administrative efficiencies, not legislation, Mr. Speaker. Mr. Speaker, we also need to protect the officers who are there right now. It's like we are assuming we are starting from zero. There are officers who have diligently served NHIF, Mr. Speaker, and therefore their right to a decent job must also be protected, Mr. Speaker. Mr. Speaker, in this particular bill, I'm aware that this is a country of regions. This is a country of tribes. This is a country of, call it, because that is the foundation of the nation state of the Republic of Kenya. Mr. Speaker, we must be careful because right now the information outside there is part of the provision of this bill is meant to provide employment opportunities and exit those who are there, Mr. Speaker. If that is the agenda, then I can assure you, you will not succeed. If the agenda is to modernize, then we'll be there to support this particular bill, Mr. Speaker. Mr. Speaker, finally.
Mr. Speaker, with all respect that I have for Honorable Kenyan, I think he has been mixed up with the bills because the bill is debating is a bill in the next order after this. And I think for the convenience and the relevance rule
I have noticed so, yeah. But since he says he's winding up, let him wind up.
No, sorry. I think you have limited your horizon of appreciation of this particular bill, my dear sister. You need to look at the bill holistically.
Just wind up.
But I think let me say this, and I read. Let me read this, and there's no confusion at all. The bit I'm trying to say is, if you look at both the letter and the spirit of both bills, Mr. Speaker, then there's a bit of reference to the existing staff. So I'm sounding alarm. Just this, even as you operationalize this, the qualifications that you have given, I can assure you by the time we pass this, the next thing that you'll see is opportunities and vacancies for directors and this. Let's accept this, that's the reality. And that's what I'm alluding to. And I really understand what, I can bet that, Mr. Speaker, after we enact this, that is the next thing that you'll be seeing. I'm saying it is good, but we shall also have regard for those who are there because this country has some of the best human resource capital. That's the bit I'm trying to say. I'm not in any way insinuating any improper motive actually on the good chairman, my friend Dr. Bokose. And finally, Mr. Speaker, there's one thing that we must accept as a country. Mr. Speaker, we have legislated. We have done everything. What we require is goodwill. I don't know how we should have, I'm told you have your own Hippocratic oath, Mr. Speaker, in the medical field. There is something that we need to eject so that once we have professionals in this particular field, the challenges NHIF has had, Mr. Speaker, will not be there. And therefore, as it is, subject to those provisions that I'll bring an amendment like the definition of a household so that it contextualizes the African framework. It's a good bill, we support it, and I hope it's going to inject fresh blood and energy in our health sector. I support.
Mary Massa.
Thank you for the opportunity, Honorable Speaker. I arise to support the bill on digitization of health systems. And Honorable Speaker, I want to go straight to the aspect of integration. The fact that now hospitals there will be a linkage between hospitals in the counties and national government, that means that there will be reduced costs, because as it is right now, you find that if a patient, for example, has been attended to in a level 3 or a level 4, and there is a referral to a level 5, the same investigation, the same tests that were undertaken end up being repeated again before the patient can be attended to. So by having this digitization in place, it will help reduce costs, not only for the patient, but also for the service provider. Honorable Speaker, this will also ensure that there's better management of the patient, because then there is access to the history of the health conditions, and therefore this patient is able to get better treatment and the timely treatment, and therefore there'll be a better experience for the patients. Honorable Speaker, I'm also very happy with this bill because it is addressing the issue of security. Issues of personal health treatment are private matters. So this bill seeks to increase security, enhance security of health data. And therefore, by doing that, it will also build confidence in the patient. And therefore, many patients, many Kenyans will be encouraged to go to hospital, seek hospital treatment as opposed to self-treatment, where people are just walking into a chemist and buying medication for an imagined treatment, because sometimes also arising out of fear of security of their data in these hospitals where they go to seek for treatment. Honorable Speaker, also general digitization of healthcare system will eliminate so many inefficiencies in the health sector. For instance, it will also provide an audit trail. We've been having problems with the KEMSA, with the medications, where medicines have been delivered. They cannot be traced as to who they were prescribed to. I believe with this digitization, we shall be able to know what quantity of drugs went, for example, to Busia County. And that can be traced to which patients were prescribed this medication. It will be very easy to get that kind of information. And also this will help us fight corruption in the health sector. With the digitization, it will be very easy to trace most of these inefficiencies within the sector. I still notice that a lot of data is still collected manually. So issues of reporting, data that is shared with national government, shared internationally, there will be enhanced reporting.
Yes, Honorable Master, hold your horses. Yes, Honorable Chief Congo, what's your point of order?
Yeah, thank you, Mr. Speaker. As you know, I believe in order myself. So I rise pursuant to Standing Order number 95. Mr. Speaker, as you know, you must have had my very good friend, Honorable Kenyan. He was in fact mixing this bill and the next one. So that we allow people to contribute, even in the next bill. And you know, Mr. Speaker, there is this sugar bill, which is very important, Mr. Speaker. And we are all sitting here to ensure that we pass this sugar bill. So, Mr. Speaker, In fact, everybody who has stood has supported this bill, Mr. Speaker. Would I be in order to request you, Mr. Speaker, to call upon the mover to reply?
Let Honorable Massa finish.
Thank you, Honorable Speaker. I am also sitting here waiting to contribute to prosecute the sugar bill. But I was on my last point. I was saying that the digitization of this health sector, the systems in the health sector, will also
Honorable members, is it the mood of the House that we call the mover to reply? Let me give Robert Mbui as the last speaker, then Ichungwa recollect your issues and reply thereafter. Robert Mbui.
Thank you, Mr. Speaker, for this opportunity to also give my opinion on this bill. You know, the issue of digitization is all over now, and I think almost all sectors of the economy are getting digitized. So it's a good idea for us to digitize our health sector. And of course, as we say, all dreams are valid. But it's important, Mr. Speaker, as we go through this, to understand maybe the positives and some of the challenges that we may actually end up finding in this kind of setup. Mr. Speaker, the advantages are obvious and have been talked about by very many of the members. First and foremost, I believe that treatment will become cheaper because there is sharing of resources. When one doctor can be able, or one technician can be able to serve many hospitals at the same time. And then, of course, that means even the equipment can be shared, so that makes it easier and cheaper. Mr. Speaker, also it will be faster because you can get instant feedback. Mr. Speaker, also the history of every medical patient becomes easily accessible, and therefore that means that in case there is any settlement or need to settle a medical dispute, then all the information is obviously readily available. And Mr. Speaker, I would also imagine that in the
What's happened to...
Yeah, Mr. Speaker, that is what I was going to add. The issue of the safety of security, how technology actually works. If it were possible in the future, and I would propose that they find a way maybe even to connect this system with the one for the registrar of persons, so that those that lose their lives in hospitals can also be immediately recorded so that we can be able to issue their certificates. Mr. Speaker, of course, the agency has its work cut out for them, because for them to ensure that digital data of patients is protected, it is a very, very tall order. Mr. Speaker, we have to look at it this way, that a lot of the systems that we have already in this country, they are sometimes prone to failure. I mean, look at almost all our state corporations, NHIF, NSSF, pay as you earn. The minute many people log in to try and do their end of month, returns, suddenly those systems are not working. So you can imagine the number of patients. If many patients are logging into the system, it has to be very, very well done. So, Mr. Speaker, we have to be very careful about the kind of technology and the kind of system that we put up, because that system may also be a problem. Mr. Speaker, careful that we do not have any possibility of people hacking into the health system, because if that were to happen, Mr. Speaker, they could corrupt data and, of course, put our people's lives in jeopardy. So it's really, really something that we need to look at. Mr. Speaker, also, you know, for us to have this health system work and for the digital system to work, we also have to have ICT, we also have to have Wi-Fi. Mr. Speaker, we are talking about our dispensaries being able to send data to hospitals in the city, to hospitals that are level 4, level 5. Mr. Speaker, where is this digital connection? We were promised digital connection in our markets, in our villages. Mr. Speaker, it is still not there. So as we are coming up and we are proposing to pass this, Mr. Speaker, this is likely going to end up being hot air. We talk about it, we pass it, and we are unable to implement it because we do not have the infrastructure, Mr. Speaker. So, Mr. Speaker, I am not opposing. I am just posing a challenge.
Let's hear a point of order from the Deputy Speaker.
It's a point of information to Honorable Mbui.
Honorable Mbui is being a pessimist, and if he believes that technology does not work, you should stop carrying your phone and not use a telephone. In fact, you're speaking on a microphone here in this house, courtesy of technology. You're speaking in this house, recorded by Hansard, courtesy of technology. Are you telling us that we must just stay frozen in time and remain in the Stone Age times just because you fear technology and that you're a pessimist? Yet he's a beneficiary of technology. Thank you, Honorable Speaker. In fact, the voting that went on in this country that you are elected on was courtesy of technology. So you should give up your seat first if you don't believe in technology. Thank you, Honorable Speaker.
Mr. Speaker, I would have liked to ignore that because I talked about the promises for Wi-Fi in our markets, in our villages, which is still not there. And Mr. Speaker, that is a fact. So I'm just saying that we are likely to pass this bill, and then the dispensaries in Kaviani cannot be able to send this information. Mr. Speaker, can I have some information, please, from my whip of the minority?
You can't. Order. He has not sought to inform anybody, and you have no capacity to solicit information while you are on the chair, on the floor, sorry.
Mr. Speaker, have you heard him now?
Yes. I have not heard anything. Go on, Robert Mbui.
Thank you, Mr. Speaker. So
And
basically, I'm not opposing the bill. I'm just posing the challenges that we are likely to face in the implementation. Otherwise, I said all dreams are valid. We need to work towards the possibility of making this work. But finally, Mr. Speaker, again, even after the technology.
Do you want to be informed by UNED?
Yes, I want to be informed by my whip.
Mr. Speaker, thank you for your indulgence. Mr. Speaker, I wanted to inform my deputy minority whip that he is not opposing the bill, but what I wanted to inform him is that technology can fail you at the hour of need, when you need it most. Imagine, Mr. Speaker, technology that fails you at the hour of need, what will you do about it? That's what he's trying to point out, Madam Deputy Speaker. He's not opposed to digitalization at all. He's just telling you that technology can fail. So be prepared that, the other day we were told 25,000 markets will be digitalized. Some worked, some did not work. When people boarded a matatu, it did not work. When they came down, it was working. So that's what he's trying to inform you. Thank you very much.
Yes.
So Mr. Speaker, as I finish.
Yes, Chepkonga, what is the point of order?
I don't want his information.
He's not informing, he's on a point of order.
Mr. Speaker, thank you, Mr. Speaker. I rise pursuant to Standing Order number 91 on factual statements. Mr. Speaker, the minority whip purported to want to inform my very good friend, the Honorable Mbui, and then ended up informing the Deputy Speaker, who was on a point of order. Mr. Speaker, on a serious point of order, my very good friend, the Honorable Mbui, he knows, and which he should have brought that information to this House, that when the permanent principal secretary for ICT appeared before a committee, in fact, he even gave one of his markets to be connected, Mr. Speaker. So I don't know which is this failure of technology when he knows I liberalized telecommunication in 1999. He walks around with a mobile which has never failed, Mr. Speaker. He gets me when he wants me, Mr. Speaker. So I don't know which is his technology where he gets, which is going to fail. The statement, Mr. Speaker, in itself is inaccurate.
Okay, wind up, Robert.
Thank you, Mr. Speaker. I would have loved to ignore my chair, but Mr. Speaker, as I said before, I am not opposing. I am just posing the challenges we are likely to face. Because even as he says, there is a market in my constituency that's being connected, the dispensaries are not. And here we are dealing with issues of dispensaries. So, Mr. Speaker, I finally want to just say that we also have to be very careful that as we pass very good legislation like this one, we also have to have the right people managing the technology also that will be in our hospitals. I know the people that serve in some of the dispensaries in my constituency, and I really wonder when we have this technology, who is going to manage them? So it also means that we are likely to end up increasing the personnel that are in those dispensaries, and I'm wondering who's going to be carrying that burden. Is it the counties? Is it the national government? Yet even some of our dispensaries are not functional because they don't have enough staff. So with those remarks and concerns, I do support the dream. Thank you, Mr. Speaker.
Honorable members, I'll now, pursuant to this point of order raised by the Honorable Chepkonga, I'll now put the question that the mover now be called upon to reply. As members of that opinion say aye. Will those of the contrary opinion say nay? The ayes have